to Think for Yourself Clubhouse. My name is Bill Martin, and I'm here today for an interview, kind of a deep dive interview actually, in social services in Jackson County with Dr. Jacqueline Heiser. She likes to be known as Jackie. Helping today, actually asking most of the questions, will be Dennis Reinhardt, my co-host, and Lisa Parker, who takes a particular interest in her, especially in her profession, in the social service side of Jackson County. Dr. Heiser, may I call you Jackie?
Yes, please.
All right. Where were you born and where did you go to school? Get a little bio here.
Sure. I was born on the east side of Cincinnati, in actually Claremont County, which is an Appalachian county, just as Jackson is. I went to the University of Cincinnati, undergraduate. I received my degree in education, special education, in 1972. My area of concentration was education of deaf and hard of hearing. I stayed at Cincinnati for one more year to pursue my master's degree. Unfortunately, I did not finish my master's because I met my husband, Larry Heiser, who was from Wellston, and married him and moved to Wellston at that time. So when I came to Wellston, I taught in Wellston City Schools for 2 years. I taught children with learning disabilities. I left there and did Health and Human Services for Head Start of Jackson-Benton County. I did that for another 2 years. I then stopped. We had 3 children. And in 1990, when my children were 11, 9, and 6, I woke up with this wild hair and thought, you know, I'm going to be 40 years old and I've always wanted to go to medical school. If I'm going to do it, now's the time. So I took the courses I needed at OU for my pre-med and applied to Ohio University College of Osteopathic Medicine and was very fortunately accepted. So I spent 4 more years and driving back and forth to Athens. My husband, thank you, Lord, is the best man in the world. He took care of the 3 children while I was in school. And I did my residency in family medicine at Oblenis Hospital in Athens. I then went to work in family medicine for Heiser Hospital, or Heiser Clinic, Jackson, up on the hill as we call it. I was there for 10 years. Then I, as usual, got bored and went and did a fellowship in emergency medicine and worked in the emergency room in Gallipolis and Jackson until 2015. At that time, I left the emergency room and kind of thought about retiring, but instead I went to work for Carnival Cruise Line as a ship's doctor for 5 years. So when COVID started, I came back home and was approached by Health Recovery Services, which is an opioid treatment recovery center in Athens, Jackson, Logan, and Meigs County, and Gallia County. So I worked there until just 2 weeks ago when I retired.
Okay. I've known Larry, your husband.
Yeah.
He's been practicing in Wellston for about as long as I've been practicing in Jackson, and looking at us, you can tell that's been a long time.
50 years.
And I think it's something remarkable that a lady, instead of saying, well, I'm a lawyer's wife, I'll just sit back and be comfortable, you decided you'd learn about the human body and treat it. And you've been doing that now for decades.
Yes.
So
yes.
it's a little bit different path through life, Jackie, and congratulate you for it.
Thank you. I tell young women who are frustrated that they're not going anywhere, I say, you're young. You know, you have the rest of your life. You've got so many years to do so many things with your life. Take care of it.
Okay, so I think what we want to do today is focus on your most recent employment with addiction services.
Mm-hmm.
If you could explain how that works. First of all, your set of patients, we know you know your way around the human body and all your experience, but your patients have an addiction problem. What kind of folks are they typically?
They're from all runs of life, from someone who's never really done much with their life, very sadly, to professional people. The thing about addiction is the fact that if you have the gene for it, and that gene gets stimulated, you can develop an addiction. It could happen to all of us easily if you have that genetic predisposition for it. So that's what I found in my patients. It didn't really matter what social class they came from, income, if they were stimulated to, if that gene was activated. And many times it was from a surgery. In fact, I'd say probably, I never did a formal study about this, but I thought about it a lot when I was working. I would estimate a minimum of 80% of my patients became addicted because they were subjected to painkillers from accidents or surgeries. And it just didn't stop for them. That gene was activated and they were off and running.
And I suppose this is a common story among veterans as well, especially in the fact that we seem to have endless wars and endless injuries, and our young men come back hurt.
Yes. I did
Men and
not,
women, excuse me.
Right. I did not work with many veterans because the VA takes care of most of those patients. However, in talking with friends who work for the VA, that's a huge problem at the VA, is people who have become addicted because of surgeries, and PTSD has something to do with it also.
Okay. Lisa, did you have some questions you wanted to get into?
I've been working with the court with Judge Music, and in 2009, a lot of people weren't aware, Jackson County actually was one of the very first courts in the state to have we call it treatment court now instead of drug court. And I know that you were very instrumental in helping with this, so I would like to talk a little bit about the differences in how you treat an opioid addiction versus an amphetamine addiction versus an alcoholism addiction, because they're very different causations and they affect very different parts of the brain. So what are the tools in your toolkit in treating those three different types of addictions?
Sure. First, let's look at what opioids are addictive. First, we began with heroin, which is a natural compound, and then we went into things like OxyContin, Vicodin, Percocet, and those are the ones that we consider the opioids. Now unfortunately, we have the methamphetamines. Methamphetamines are extremely difficult to treat. We don't have a substitute for them like we do with the opioids. Sometimes we'll find that a patient who has problems with methamphetamines or someone who had ADHD, attention deficit, as a child, and occasionally the psychiatrist will put some of those people on actual amphetamines, which are Ritalin, etc., which they monitor very closely. So it's not just here's 30 days worth. They're monitored very closely, but that is a very, very difficult process. Alcohol, in my position, I did not deal with alcohol very much because we had other specialists who do that. There's injectable Vivitrol, which is very helpful. There are medications that you can take also for alcohol. I personally think alcohol is probably one of the most difficult addictions to recover from because it's so readily available. It's socially acceptable, and it's a very difficult addiction.
I had a friend that was he was off alcohol for about 15 years, and then something happened and he just went back.
Yeah.
I mean, he was able to do that. He was able to be around other people that drank and everything else, but it just took one crisis in his life or whatever, and he went back to it.
And alcoholics will tell you, I'm one drink away from being an alcoholic again.
Yeah.
I think that has to be one of the most difficult addictions to
So
recover from.
that would be a stimulus, you say, in the brain.
Yeah.
And if you get the one hit of alcohol, that will stimulate that addiction response.
Yeah, your addiction's like, oh, well, I did okay on one drink. I think if I had two, I'll be okay. And then pretty sure, one's too many and 1,000 isn't enough when it comes to alcohol.
It's hereditary too, isn't it?
Yeah, it's a very genetic, and that's what we'll see in the opioid crisis. People also is that there's almost always alcoholics in the family or other people with addictions. I think I said there's this gene for addiction, and if it gets stimulated, it becomes a lifetime.
And it can skip generations too.
Oh,
can't it?
absolutely.
Yeah.
It's just like any disease. If you have MS in your family, you may not get it, but a cousin might. So it's just the luck of the draw.
Well, I wanted to talk a little bit about the stigma and getting people out of the stigma of talking about addiction. I have found, because I sat down and I have interviewed people who had been through treatment court for 15 years, and they were wonderful interviews. So I'd like to first start with, stop saying, oh, they're just druggies. These are someone's child. They are someone's parent and someone's grandparent. I'm on the overdose and suicide committee that we have for the county. So finding those numbers are quite interesting, and we'll share those in a little bit. What I found was, as you brought up, the number one cause of opiate addiction, which might surprise most people, start with an injury. Mm-hmm. They've had an injury, they were overprescribed a painkiller, and then just cut off. The military also did this. This is why the military has such a high suicide rate when they ran through their studies. So that was the number one cause that was shocking, and a lot of them started in high school with our athletes. They got an opioid, they were injured, they played hurt, and then when they couldn't get it anymore, they went to other substances.
Question for both Jackie and Lisa. You said the word OxyContin as you were rattling off these drugs, and you said it's an injury and you got a prescription. Is that link us back to OxyContin?
Oh, absolutely.
And what was going on is that company is known to have pushed
and we haven't
that
seen
drug.
any of that money yet.
I, as a physician, at the time that OxyContin was first coming into being used, we would have drug reps come almost every day saying, hey, we got this new drug. And, we've formulated the OxyContin now, so it's not addictive anymore. So you can prescribe it and not worry about it. And by the way, we have a conference out in Denver that you can come to for free. We'll send you airline tickets and put you up in the hotel. And if you want to ski, we'll take care of that. Really we'll just look at how much you're writing for, and the people who are writing for enough of this will be able to come to this. And I'm like, and my answer was always no. If someone has that much pain, then they need to be with a pain specialist. This is not something I'm comfortable doing. But we were pushed all the time by the drug reps.
Well, since you brought that up, I think you've really hit on something extremely important. And correct me if I'm wrong, but the brain chemistry after 3 weeks on an opioid actually completely changes.
Correct.
So that if you have a prescription for more than 30 days or 60 days, unless you're terminal, that prescription is actually changing your brain chemistry.
Absolutely.
And when it changes your chemistry, your brain thinks it's in pain when it actually, you aren't anymore in physiological pain. Is that correct?
As far as I know, that is correct, yes.
So when we get these young athletes that are playing injured and continue on that, they're also in the process at a very young age. I guess the age of development is under 25.
Correct, especially for males.
And
The frontal lobes don't really develop strongly until 25 in males.
And primarily our problem is we have many more males that are in addiction, and then they get a lot of times in trouble with the law, but they all started at a young age with these, and it's that their actual brain chemistry changes.
That's why a very important part of opioid treatment is the counseling that comes along with it, because people have to learn to reprogram their brain. Their best thinking got them into this mess. So, the counselors, who are just excellent, have to work with with people to just kind of help them reprogram themselves and see where their thinking was off.
And part of what we do in treatment court now is we actually call it adulting. And you're right, it's when they started their addiction is when they stopped developing as an adult. So we usually, even though they may be in their 40s, we're actually dealing with teenagers and bringing them through an adulting process.
It's very true.
The other issue that I have found is a trauma, PTSD, and mental health are the next three that I found that people talked about, and they were self-medicating. But they typically don't use opioids. They're the ones who get into the methamphetamine pills.
I also see a lot of benzodiazepines
Yes.
like Valium, Xanax bars. Those are big on their list too. I was very amazed in the number of young women who disclosed to me the sexual traumas
Yes.
they had experienced as young girls, as young little children. I was just totally blown away with how high of a frequency that was among people with
So
addictions.
that was like a psychological trauma. They self-medicated
Yes,
and wound up in your office.
correct.
I see.
Yeah, they're trying to turn off the noises in the trauma. In fact, the Supreme Court has now said in treatment courts that we're to explore and actually, where we used to put everybody together for treatment, now we're taking the women separately because the pervasiveness that we're finding, not only with the sexual trauma as a child, but that they are sex trafficked then by a partner to pay for addiction.
Exactly. Yeah.
And
Lisa,
it's-
I have a question.
Yes, sir.
As a lawyer, in the old days, I would get appointed to criminal defense work, and as I got older, other fellows, lawyers, got that appointment work. But there was one case where Judge Music had so many defendants. Well, they called me up, and I wound up with two of them. So I go in and I meet my clients, and it's just like you read about in the newspapers and see in the movies. These folks were haggard, underweight, their skin was scaly, and they acted like they were depressed. They didn't care what was going to happen to them. So I got them off into the interview room and I said, "Don't you understand you're going to die? You have to do something." And they looked at me and they said, "We understand that." And basically went in and pled guilty and took what was going to happen to them. But that's the magnitude of the meth. That was the meth addict that I was
The
describing.
methamphetamines are very bad. In fact, I've had patients say to me, "I would rather die than go through the sickness I have to go through when I withdraw from this medication."
Well, that's a great segue into. Would you explain to everyone about the tools of Suboxone and Sublocade?
Sure.
Because a lot of people say you're just substituting one addiction for another instead of having a tool so that the body itself can retrain itself,
Right.
and how we wean them off.
I like to tell my patients, if you had diabetes or high blood pressure, what would you do about it? Well, I would take my diabetic medications or my high blood pressure medication. Well, you have a chronic disease called addiction, and the way to treat your addiction is with medication. Now, that could be Suboxone, which is a buprenorphine and naltrexone together, or Subutex, which is just the buprenorphine, or Vivitrol, which is just the which is basically just the Vivitrol. It's just basically the what am I trying to think of, the naltrexone,
Right.
right, or methadone. Okay, and basically what those drugs do is the addictive medications, methamphetamines, opioids, benzos, they latch on to the receptors, the nerve receptors. So what happens when you take the Suboxone or the Vivitrol, they release that addiction medicine, and instead the Suboxone or buprenorphine latches on. So you're getting rid of the addictive medicine. Do you become addicted to the Suboxone? Probably. Probably. I mean, when we take people off of the Suboxone or the methadone, we wean them down off of it when they're stable and feel like they're at the point to do that. But yes, it's you are taking that medicine is taking the place of the medication that you were addicted to.
I had an experience with that as well. Judge Music at one point was trying to get older lawyers to act as mentors for some of his, at that time we called it drug court subjects, the defendants. Basically, the deal was you can take treatment or you can take punishment. What would you choose? And he says, I'd kind of like to have treatment. So what the treatment consisted of the substitute drug, and then the game was over time wean from the substitute drug. In the meantime, maintain social relationships. Try to have a stable relationship with a girlfriend if that's possible in your life. By all means, get a job and try your best to keep it. So this chap took his substitute drug. He had a job. I believe he was working at Kroger's. I'm not sure. And he had a kind of an on-again, off-again girlfriend. So all those were good things. When you're able to have a relationship with another human being, it's always a good thing. And weaned him down and down and down. But it busted. It didn't work. And Judge Music told me, a lot of times it just doesn't work. And he said sometimes the best he can do is to get that guy. This guy's problem, I think, was his old circle of buddies.
That's no
Absolutely.
idea. You mentioned that,
What I have to do with these people is get them physically okay and then get them out of town. And sometimes he'll go to a treatment center in Florida.
Yes. Excellent. St. Matthews.
Run his defendant through the program in Florida, and then they stay in Florida. And the benefit of that is they don't get back in the old crowd, which will try to drag them back down into the swamp.
Right. There are people who would maybe have to be on the Suboxone for the rest of their life. Why not? You got your family back, you got your job, you got your home. Why not?
And
if
it's
you're a
being controlled.
diabetic, you're going to be on your medicine for the rest of your
Well,
life.
Jackie,
So we never force or push anybody to get off the medicine.
Some people don't understand, though, after you've been a long-term addict, tell them what happens to your body physically with this long-term addiction and what going cold turkey would be like.
Yeah, my patients describe to me that is like having the worst case of flu times 10, that you just want to die. Your body hurts, your head hurts, you vomit, you have diarrhea. It goes on for long periods of time, weeks. And it comes to the point that I'd rather take the medication and possibly, not the medication, I'm sorry, would rather take the opioid and possibly overdose on that than to feel the way I do. It's that.
And if you'll remember, at about 2018, there was a big HECAC with United States military where the Army specifically had this huge explosion of suicides. And the United States Army ran a big study. Why is this happening specifically in the Army? And what they found was the Army, to keep their troops fighting, addicted them to opioids.
And probably methamphetamines.
And then when they were discharged, they lost their dealer. And they said that a lot of it had to do with not only the psychological addiction, but physically they were so sick they couldn't get a fix, and so they committed suicide rather than to go through the throes of going through this or finding out what the underlying cause was. So it's very real, and a lot of the things, the preconceived notions that I had prior to working with treatment court to where I am now, I have dramatically changed, and I've discussed it with my husband a lot. I mean, it's not what people think.
Well, and I've had patients say to me, they've maybe overdosed 2 or 3 times and say, aren't you terrified of overdosing again? No, I would rather overdose and die than go through the withdrawal I was going through.
That brings us to Narcan. Tell us about Narcan, Lisa.
Since I run statistics,
Yes, good.
we're under the false assumption, how am I going to word this right? We've had people in the city and county think that we no longer have a crisis, because the raw numbers of overdoses and death by overdose are, thank God, down.
Right.
Death by overdose. The problem is we are now finding out we have an unintended consequence of Narcan. When we had a rash or a string of overdoses in the county, we would immediately do tissue testing and sampling, and then we would find out, like when we had a really bad batch of fentanyl or carfentanil or xylazine hit the county, we could get a word out. Hey, this stuff's just hit the county. This is xylazine. This is what it'll do. With the Narcan, people are living. The problem is they're not calling a squad. They're not calling police departments. And so we're still having this amount of overdose. We're just not aware of it. So people get this false sense of security that we don't have a problem. And then when we get a death, because Narcan doesn't phase xylazine.
Right.
And so where did it come from? Well, we would have known if we'd have gone through the channels that we used to. So I really am concerned that while you can go to, we have all these free locations where you can get the Narcan, that we're not getting the reporting that we need so we can be proactive or get them to get the medical care that they need.
Narcan is not a cure, right? It just stops you from
It
dying.
keeps you from dying.
Right.
And they repeatedly use it again and again.
Oh yeah, you
Yeah.
can go you can go to the police department. They've got a big vending machine. It's free.
The rest areas have them in the bathrooms in the rest areas too, I noticed. I'm glad you brought that point up, because, you know, that's something I really haven't given a lot of thought to, because our numbers are pretty stable over the last 5 years. But they probably would be much worse had we not, had we been able to keep track of the. I know that when I worked the emergency room, we would have the same person come in sometimes 2 or 3 times in the same day, overdosed, and we would bring them back, and they'd leave and come back.
I have a question for both of you, women. We've been talking about a lot of cases and all this. Are there any actual numbers, raw numbers you can give us for Jackson County?
Oh, I have
Yes.
lots of raw numbers.
She probably has better
Well,
numbers than
give
me,
some
but-
that our viewers would relate to.
Jackson County, until this year's numbers come out, was in the top 5 in the entire state for suicides per capita. What's surprising is you think it's younger people, and it's not. It's the over 40. And most of those people have had a drug or alcoholism issue. They're trying to mask depression instead of getting proper depression treatment that they should have. And the prevalence of, oh gosh, I'm going to get in trouble here. Most of our young men do die by gunshot, because there's no coming back from that. So those are where we stand. Statistically, most of our men are dying by gunshot.
When you say most of your men, what you mean is suicide victims
Yes,
who are male,
yes,
die by gunshot, because
yes.
that works.
That works, it's quick, it's effective, and you're not bringing them back.
Much more than women. Women have a much more tendency to overdose.
Although we've had 2 that died by gunshot to the head, and from a law enforcement standpoint, that is statistically a really off-the-wall anomaly. That still bothers me.
It is.
Jackie, did you have some metrics for us?
Oh, I just, what I had was, as of 2024, the number of overdoses was 90 for the county. Dead on arrivals in the emergency room were 4. Transferred from the ER were 24. Suicides 4. Overdose deaths 10. Now,
That's from your ER?
From the
that's
ER.
the ER. That's correct.
Okay,
yes.
and you,
And
you
we-
have a different body
Yes,
of
Yes,
ours,
we have-
ours are
statistics.
heavier because these are the ones that are found at home,
Mm-hmm.
maybe found at a later date or found by a family member, so we get all of them.
At any given time, how many people would be in your, I forgot, I keep calling it drug court, treatment court.
Well, we don't have enough of them in treatment court, so if any family members, we really, And I'll tell you how effective it is, and I know Dr. Jackie has seen this. We have a gentleman that's getting ready to graduate. We're so proud of him. I remember the day he came in to be arraigned. He had overdosed twice. Emergency room sent him back second time in a day. He looks like a caveman. He's shackled, he's in prison stripes, and he is screaming at Judge Music that he hated him. He wasn't going to do this. He wanted to die. I mean, called the judge a lot of names, but the judge understood he was still high at the time. And he said, I'm putting you in jail. And believe it or not, sometimes jail is the most effective place to put someone in that condition. He put him in for 2 weeks, brought him back in. He was still not going to do it. He was angry. He went to HRS, and he still kept him incarcerated. So now we're into 30 days. Well, this time he came back and somebody trimmed his hair up and he cleaned up a little bit. He was more articulate. Long story short, this gentleman now leads a lot of meetings that he goes to. Mm-hmm. He has a thriving business that he had let fall by the wayside, and this is not a young man. His relationships are back with his adult daughters. He is absolutely a star, and he will tell you, but I thought I wanted to die. He was just bound and determined to kill himself one way, and you probably know who I'm talking about. Like I said, he's an older gentleman, and it works. It just takes time, and other people sometimes having more faith in you than you have in yourself.
So I think most neighborhoods in the county are afflicted by this problem.
Most families are.
If anyone tells you they don't know anyone with an addiction issue in their family or immediately circled, they are delusional.
Absolutely.
It's that common.
It is absolutely
I
common from the breadth of everyone here.
I have cases in my family.
Yeah.
You know, it's just everybody I know does.
I personally had 2 sons who went through addiction. Both of them had surgeries, were given the meds, and I didn't realize that they were addicted until they were stopped by the police and ended up in drug court. And I called the judge and begged him. I said, Mark, do not let them out. Do not, throw the book at them, because this will save their lives. And he did. And they're both clean, living productive lives now. They went through the program at HRS and before I was there. And it's miraculous what can happen. One thing we haven't spoken about, however, is there are two different ways to approach addiction. There's the no medication, 6 months in a treatment center, as opposed to ours, which is outpatient service and living at home, etc.
One of them is like drying out.
Exactly, yes.
Okay.
But the statistics show that the treatment, the medication treatment, is much superior to the behavior modification type of therapy. The problem with that is when they're there in that little community, they're not tempted by anything. They're not back in with all the people that they grew up with and that they're buying from. And unfortunately, those people, many of them, go back to using again. So I guess that's why I'm so in favor of medication and treatment.
Yeah.
Medication
Like
assisted
Judge Music
treatment.
used to call it, same old crowd syndrome.
Right, and one of the things that Judge Music really looks at when we decide whether we're shipping them out of state for treatment versus here is if they have that good circle. We have a lot of people when they come to treatment court, family will come if they've got that good strong circle, and if they don't, those are the ones you don't want here because they're going to be right back in the same thing. You want to ship them away.
Do you know anything about this region of Appalachia, the Appalachian counties, Jackson, Meigs, Hawking, all those? How do they compare to the rest of the state as far as, I guess you would call it per capita, you know?
As far as the statistics of people in addiction? Or
Prevalence of addiction.
Oh, well, I can remember hearing even on NPR talking about southeastern Ohio was one of the largest areas of addiction in the United States. So I don't have any proof of that, but
Do you know anything?
that's my understanding. Particularly Scioto County. Scioto County
It's
is,
the
Always heard
epicenter.
that.
It's
Oh
the
my gosh.
epicenter.
it is,
But it's that Route 23
It's on the
from
highway, yeah.
Detroit
right.
clear on to
The supply pipeline.
Well, and one of the problems that people here had to, that there were no employment opportunities. Now I have many of my patients who work at Belicios. I mean, they'll take them. They're on medication. They follow up. So now the corporations are opening up and allowing some of these people to come and work for them, the stable people. So I think that's helped somewhat too with the number of addictive people
We have a very good placement service now. Our number one goal is, the old saying, idle hands will do the devil's work.
Right,
So
exactly.
I go through, if we have an applicant that doesn't have their high school or GED, that's number one. The judge, we've had to go through to where he orders it. That's part of their treatment plan. You have to, so they have to stick with it. That's part of their plan. But once they do that, we have different services to help get them specific training. And now we will have employers actually contact the court because they're such good workers. They know they've had their training. They know that they're in treatment. And they will actually call and ask for workers for something. And that's been very helpful.
It's going to be
And
extreme.
But
the worker
if-
has an incentive not to screw up.
That's correct. But if they're not in treatment court, there is no means other than probation puts them on a hold or back in jail to get them or give them incentive.
Lisa and Jackie, I'd like to change the subject a little bit. I would suspect that all these services cost money. And how would they, in your experience, how are these treatment services funded?
90%, maybe higher, are Medicaid.
Yeah, I would say. Thinking of my patients, I can think of maybe 2 that are Medicare, maybe 2 that are private pay, and the rest are Medicaid.
We have a few older adults that have Medicare, but Medicare will only pay for so much medication. Private insurers will not pay for Vivitrol. We had a young woman who's an alcoholic was having to pay $1,400 a month for Vivitrol because her insurance would not cover it at all.
Right.
We went to a provider who had a grant that covers her Vivitrol shot. The Sublocade and the Suboxone would not be covered by anybody but Medicaid. So without that, we have no way to pay for addiction service to include sending them to in-service rehab. So if they need to go in for 6 months, Medicaid will pay for that. Medicare, a lot of people don't realize, will only pay for skilled nursing for just a regular elder adult for 30 days, and that's it.
Okay, the viewers should have several takeaways from today's discussion. One of the ones that I certainly didn't know about was these things begin with injuries, even sports injuries, and pain medication is not handled properly.
And
That's where a lot of these things go. So, viewers, that's something you can take away and something you can pay attention to in your own lives. Also, we learned that this is prevalent, even though we have a Narcan that probably doesn't help with the basic problem, which is addiction and the physical dependence that we get from these drugs. And third, we have the takeaway that this is a Medicaid basically financed program, so that if something happens to Medicaid funding, Medicaid programs, in some respects, a lot of good people in Jackson County would just plain get screwed.
Well,
And I think that we need to pay attention to that, viewers.
Well, I'd like to tie this Medicaid issue up into the jail system. So hear me out. We are now in the process of trying to build a new jail. I don't know where that stands. The commissioners have been unusually tight-lipped about that. However, there is a system that's available called a CASC, and that's a Community Alternative Sentencing Center.
So that's CASC.
C, yes.
The alphabet soup is CASC.
And Judge Music for years has talked about either having a standalone CASC or for any new jail build, it should have an attached CASC.
Right.
The benefit of a CASC is there are people who do break the law to support their addiction, and they should be properly then sentenced. I mean, there's no way around it. But you can't get the treatment that you need in regular jail. Our jailers aren't equipped to be, even though they do have to act as mental health providers, that type of thing. If we had a CASC attached to a new jail, we could do a lot of things. First of all, a provider would handle the CASC. So a place like Hopewell or HRS would actually take control of that portion. As with any
You
treatment,
said Hopewell or HRS. Who are those?
they are health providers in this area who do mental health. They do the medications. They do counseling.
And integrated services.
Integrated services does it.
Mostly funded by Medicaid.
They are mostly funded by Medicaid and grants.
Right.
I
I was
see.
going to say HRS is has a grant from the state of Ohio. That's what they operate under.
What's
In
the
addition with health recovery services.
what health recovery services?
Right, exactly,
Okay.
yes.
So the problem is the judge then, any judge, even Judge Regan's court, they could sentence you to a CASC. What that would do is you're in a jail situation, but you're in treatment. It would be just like going to rehab. And there's literally a line drawn on the floor, and if you decide you're done with rehab, you can step over the line and now you go to jail. You finish out your term in jail. You don't have to go to treatment. You don't have to go to rehab anymore, but you do have to go to jail. If you stay in the CASC and complete your treatment, that is your jail term. You're also clean. You've gotten the mental health treatment you needed. You've gotten the medication support that you needed. You get the mental health medications if you need it. And how that saves the county is it is funded by those providers through Medicaid. So it pays for the staff, it pays for the building, it pays for the treatment, and it's not coming out of taxpayer dollars. And people don't understand it. A CASC is self-funding and would actually give extra dollars through the Medicaid use and grant funding that you can't get for a regular jail. So everybody's screaming, well, you're letting people out on the street. When the jails get overcrowded, there is no place to put. So then a judge has to make the hard choices of who's the violent offender, who's going to commit crime again, who's an addict. I mean, it's not easy. Or do I put him in for a few days, kick him out, and put this one in for a few days? It's a real juggling act.
So based on the what we've learned today about the prevalence of drug problems in this county, what we've got here is a best practices jail.
Mm-hmm. And you can attach it to a regular jail.
And how do they get a CASC?
Well, we have to find a building, and it still has to meet certain security requirements and that. So Judge Music's worked on it. We thought we had one, and then with the funding, they've decided to go with a jail. But funding the jail, once you get it built, is how do you pay for your staff? How do you keep it operational once you have the actual physical building built?
But the CASC has a money stream attached to it,
That is correct.
as long as nobody screws with the money stream.
So that gets us back to if we're losing grants in this county, everybody's being affected. We'll talk about those more later, but the grants that people were granted even after January 1, that people were notified the grants are not coming. With these cuts to Medicaid, I don't know what that's going to do. It's going to be a dramatic problem.
Right.
26% of the people in this county, just anybody in this county, 26% of 32,000 people are on Medicaid. Of the 32,000 people, 33% of our children get Medicaid and CHIPS services. Southeastern Ohio, just to kind of wrap your head around it, you can put the entire population of Jackson, Vinton, and Athens County in the football stadium at Ohio State.
So another takeaway is keep an eye on Medicaid.
Well, and I don't think people understand that the cuts come from the federal government, and 90% of Medicaid is financed by the feds. Only 10% is financed by the state. So federal cuts are really the scary part of this whole thing.
People have said, well, this grant that I got came from the state, and that's not how it works. The federal government has this pocket of taxpayer money they determined to be for grants. They distribute it out to the states. Then the states distribute it amongst their departments, and it trickles down to the county, local level. So the federal government, when the federal government says we're cutting back all this money and we're going to save all this money and we're not going to provide these things, it trickles down to the state. The state can't pick it up. And if we cut federal funding, in order for the state to continue to do those services, they're still going to have to up state taxes.
Yeah, we're going to study a specific case of the federal funding being cut off with the Jackson County Health Department. I hope to have a discussion with those folks perhaps next week. I think probably by the clock on the wall, it's time to conclude. Do you have any concluding remarks, Jackie?
I do. DeWine and the House and Senate have proposed that no matter how much the cut is by the feds, it could be a tiny cut, that they will then do away with the state's portion of Medicaid. So that was that's right now in circulating.
Yesterday.
Yeah.
So they're going to bail with it.
They're going to bail if the feds cut back, no matter what percentage the feds cut. It could be minuscule. The state's backing out. And this is on the 770,000 people who got the expanded Medicaid, which is most of our people that are on.
And most of our people on Medicaid are working.
Mm-hmm.
That's the other fallacy. They are working. Children who have special needs that are in school, not only are we doing education cuts, but the school system bills Medicaid for that teacher's aide that's in the classroom, for the transportation in the classroom, for the occupational therapist that comes to the classroom. Those are billed to Medicaid. Our transportation services to transport people to medical care is paid by Medicaid. So a lot of people understand it's not just going to the doctor or paying for treatment services. All these ancillary services are also paid for by Medicaid. Children's shots and food programs can go back to Medicaid if they have
And from your perspective, that's a lot of good being done out there in the field.
Well, in the schools, the kids would not be able to attend, like about 2 out of 10 kids have some sort of a physical disability or a learning disability, and they would not be able to go to school if not for Medicaid.
A family of 4 can make up to $44,000 a year and still qualify for Medicaid. And I don't think people understand that. They're thinking that they're these drudges of our society that are getting Medicaid. That's not true. These are people that are working at Delicios or General Mills or for the state. But a family of 4 can make up to $44,000 a year.
It's just a plain stark fact that this program is very important in Southeast Ohio.
Yes.
It will eviscerate us.
We need to face that. Okay. Very stimulating and interesting conversations, ladies and Dennis.
Thank you for
Always learn
asking me.
something.
Yeah, we learned a lot
always
today.
learn
Yeah.
something.
So
I do.
that'll do
Yeah.
it for now. Think for yourself, Clubhouse, signing off.